Ani bonjour. My name is Michael Dumont. I am Anishinaabe Martin Clan. I'm a member of Shawanaga First Nation, which is a small community on the shores of Georgian Bay in Canada, just north of the city of Toronto. And I live on the unceded territory of the Musqueam and Squamish and Tsleil-Waututh peoples in the city of Vancouver on the west coast of Canada. I'm a family physician and the medical director for the Luma Medical Center in Vancouver, and also a family physician with the Musqueam Primary Care Clinic, partnering with the Musqueam First Nation. I first came into contact with Mara and Corrine Andrews and Kāhui Tautoko in 2016. So I was looking for an opportunity to come back to Vancouver to work, and at that point I was living and working in Alberta, elsewhere in Canada, and I saw one of the postings for the Musqueam Clinic, this new clinic that was going to be starting on reserve, and Mara at that point was playing a central role in supporting the three nations, the three host nations around the city of Vancouver, Musqueam and Squamish and Tsleil-Waututh, with developing their new primary care centers. And I took to the bright advertisement right away when I was looking at the First Nations Health Authority website here in BC, and it was that very first, I think, start of what grew into I think a really wonderful relationship. And Mara at that point ended up playing a very central role in me coming back to Vancouver, and ultimately with me making my home here again. And also in supporting Luma, because she was pretty central at that point in terms of her role with our wider clinic network, guiding our new clinic, our new urban clinic, and guiding that vision in terms of what Luma could be. And ultimately what we've become here is really I think very much a gold standard for urban and Indigenous primary care here in British Columbia, and also I think we get recognition for the work we do across Canada, bringing together our ancestral and traditional ways of knowing, our understanding of health, along with the good aspects of Western medicine, and trying to create this model where we work alongside traditional healers and knowledge keepers and elders, and try to bring those two ways of knowing together so that our patients can benefit from both. Mara was a big part of those early visioning exercises, and helping to bring that vision to life with our clinic. And ultimately, what came of that initial partnership was the founding of our network. So at that point, we were a small sort of group of emerging clinics. We were working largely on our own. What Mara ended up supporting us with, what Kāhui ended up helping us with, was finding the strength in our collective voices and actually working together as a network. She was really integral at the beginning there, I think, helping us recognize that we could find a much stronger sense of advocacy for ourselves and for the people we serve, if we came together and spoke with one voice and gathered together. So we were very much an informal network at the beginning, but over the course of the last 9 years, we worked with Mara for I think the first 4 or so, and then when Mara returned to Aotearoa, Corrine came on and took over that leadership of our network, as our director, as our coordinator. I want to say, like, family is the better word for this. Really, they've the leadership that they've shown is not coming from a place of, here we're the experts, here's here's what you should do, but just getting to know us and becoming a part of our group, and becoming really a part of our family fabric of who we are, and understanding very much from an insider's perspective what it is we who it is we are and what it is that we do and what our strengths are, and maybe some of the weaknesses that we need to work upon, and how we can better advocate for the changes that we need to see happen. And both Mara and Karine, and certainly Kāhui as a whole, you know, they really understand, one, you know, what's important in working in an Indigenous community, and certainly I know we come from very different places, far away across, across the ocean, but I think our ways as Indigenous people, there's a lot of things that we hold as important, and I think understanding the way to work well in community, they bring a groundedness and a respectfulness, and just a good way of doing that work that makes such a huge difference, for us, just being in community, and having to understand, just a lot of I think the similar stories that our peoples in this territory, have experienced in terms of the effects of colonization, and working in a system that has often been very harmful for our relatives. And I think it's very similar in Aotearoa. Anyway, they brought I think a perspective that really helped us find our strength, find our voices. They really have become just a part of our group. I can't even imagine our network existing without Karine there, without Mara there, without with Kat and Celine and the whole Kāhui team. They've become friends, they become family, and they guide us with their wisdom, far beyond how most consultants would work in this sort of way. And they really do put their heart into the work that they do. We had the opportunity to come to Aotearoa in February to visit. It was a project that we built, with very much with Karine and Mara's guidance and wisdom. We were looking at Indigenous data sovereignty as sort of a key feature, I guess, or like the reason we did this trip was to learn about some of the amazing work that some of the Maori scholars and clinical groups are very much leading the way in this Indigenous data sovereignty movement. And so we came to learn, but I think what came from that trip, we certainly did learn a lot about data sovereignty, but we learned a lot about ourselves. We had the opportunity to travel all across Aotearoa and see these different really beautiful health centers and universities. We spent time in the marae, we spent time in community, and in doing so, we really got to understand a little bit more about ourselves in that process. And sometimes I think travel can do that as a teacher, but being able to be in community, and just to hear some of those stories helped us understand so much more about ourselves and what we needed to do. We really felt a strong, I think we drew so much inspiration from the work that's gone on over the last 20, 25 years in terms of language revitalization. Everywhere we went, hearing Te Reo Maori spoken, and really, like, it was an aha moment for me, just as far as like what we need to do here, what we need to do, I think in my own community, but with the communities that we serve, in and around Vancouver here in Coast Salish territory. We need to do more work on language, and we need to, we can put culture first. It's okay to put culture first. I think we have this almost colonizers view sometimes in terms of what the most important intervention is going to be, or what we actually need to focus on, and sometimes the clinical pieces get pushed ahead, I think, where really it should be language, culture, family, community, that we focus on first. And really those foundational interventions are probably going to help us get further ahead than if we just focus on the flashy things, the doctors, the nurses, the clinical roles. And what Karine and Mara did for us, the great gift that they gave to us in helping to organize that trip was just bringing us closer together as a network, and really as a family. And what we have here with our network of 8, really now 9 Indigenous-owned and operated clinics across these territories here, is just a really strong group that works together, works in the same way. We support different communities and we support different groups of people, but we work in a similar way. We work with in a relational way. We work in a way that really upholds those principles of safety and trust, cultural safety, trust, and a deep respect for the for the land that we work on, but for those community protocols that really guide us in terms of what we do. That gift that I think that they gave us was very much in understanding that connection on a much deeper level. And we could see it at our last couple of meetings. We did that trip in February and early March, and we've had a couple of meetings since then, and it was just like there's an energy in this group now that we really feel motivated and empowered to do what we need to do. And I think you'll see big things come from this, and that's kind of the spirit of what I think Kāhui Tautoko offers, is just this heart-centered, deep commitment to support the organizations that they do get called to work with, to support their goals, to really hear their unique challenges and needs, and help them achieve those changes that need to happen, and not on their terms, but on the terms of the organizations that they're supporting.